so happy to be here to get to discuss the benefits of pneumatic compression. In the continuum of care, I'm very enthusiastic about these devices as a tool in the toolbox for our patients. Here's my disclosure and a little bit about me. I've been a massage therapist for over 40 years, and I've been in lymphedema and lipedema for about 15. And I need to very much acknowledge Karen Ashforth. She and I collaborated on a project for another organization, and she compiled a great deal of this material. I'm using it with her permission, and I have to acknowledge all these others who discussed this presentation with me and helped me organize my thoughts. This is not specific to anyone, so this is general information. Please don't make changes in your care as a patient or changes for your patients as a provider based on this without further information. And just to really quickly review complete decongestive therapy, which is the treatment for many lymphatic conditions. We start with the manual lymphatic drainage, which is the gentle press and stretch and release of the skin in the appropriate directions to encourage the opening of the lymphatic vessels, the uptake of fluid, and movement toward the central system. This is generally followed by compression therapy, which may or may not begin with the multi-layer compression short stretch bandages, and then move into compression garments, although sometimes we go directly to the garments. And then another component of compression therapy that also has a manual lymph drainage component to itself is the pneumatic compression device. So that is pictured here, where there is an appliance that's on the body and a machine, and it's pumping air in and out in the appropriate direction. Also in complete decongestive therapy and important for general human health are exercise and movement to the capacity of the individual, and excellent skincare. So the pump, as I mentioned, pairs a machine with an appliance. So the appliance is a garment or something that is worn on the body. In this presentation, we are discussing those that are FDA approved for the treatment of lymphedema, and those are multi-chamber appliances. And the machine pumps air in and out of the chambers in various patterns to mimic that manual lymph drainage type result and create that directional flow that we are seeking. It's often called a variety of different names. I'm going to try to use IPC or PCD in this presentation. So the device has a variety of features and benefits, that I should say the paired device and appliance. It has that similar to MLD and the compression factors. It allows the patient to have some autonomy in their treatment. Basically, they can don the appliance, get comfortable, push a button, and receive care. And that relieves some of the burdens of travel for the patient, can relieve some financial burdens. It can be soothing and enhance a parasympathetic type response. It can help with blood flow and wound healing, and most importantly, increase mobility and improve quality of life. But it can't substitute for a therapist. I have seen these devices used in the context of a therapy session to maximize the ability of the therapist to provide the most comprehensive treatment at an individual time, but that therapist still needs to respond to patient feedback, still needs to notice what's going on with the skin, and check for any kind of changes. And the machine can't do that. It can just do its function of pumping in and out. So a little bit of the history of these devices, just super briefly. They've been used for venous and lymphatic diseases for a long time, and a little more recently for lipedema. And the use for DIRCMs is less well documented, but I did find some information that DIRCMs patients are using these successfully. Yeah. And technologies has evolved from the single chamber to the multi-chamber devices. And as I said before, we're talking about multi-chamber devices today. Single chamber devices are still used for other purposes, but not for the FDA approved treatment of lymphedema. And they initially treated only limbs, and we want to treat with these diagnoses into the truncal components and the chest components of the body. They have a variety of modes. I'm going to talk about a couple of the primary modes, and they have a variety of pressures that they can offer, and we really want for our patients to have a lot of customizability so that we can address all the particulars of the individual. We would use it in these diagnoses. We would use it to prevent blood clots. We would use it to address arterial and venous conditions. Great for helping orthopedic surgical recovery, reducing pain, improving function, and it's really helpful for those who are unable or unlikely to perform self-MLD. And there could be so many reasons that a patient would find this challenging or too stressful to do. If you have a large body area that needs manual lymphatic drainage, that can be strenuous, it can be time-consuming. You might have upper extremity concerns that make it very difficult. I've had patients with arthritic hands who find that it's extremely difficult to perform their self-care. So these can be hugely helpful for those. And also, insurance is not likely to cover maintenance manual lymph drainage. So having that option to self-treat at home can be very helpful to quality of life, et cetera. We don't want to use it in certain situations, and that is anytime we don't want to be pushing more fluid back toward the central system for whatever reason. And that could include infections or untreated blood clots, severe vascular diseases, congestive heart failure that is not cleared. It is not an absolute contraindication, but if it's severe, it most likely is. We're not going to squeeze over a baby on board. So there are a lot of reasons that we would avoid using these, and that is a conversation for a patient and their provider. So I want to talk about insurance because in best case scenario, we are going to be able to get our insurance to help us obtain these devices. I believe that in most cases, it is cost effective for the insurance company to do that, but there are always rules around insurance. And we'll start by talking about Medicare because so many insurance plans follow Medicare guidelines. And with Medicare, we need that diagnosis of primary or secondary lymphedema or a wound that has been non-healing for 6 months or more. Lipedema without lymphedema may be qualifying in some private insurance plans. It is not with Medicare, but you know, if you have the lipedema diagnosis and you may also have a lymphedema condition at the same time, you really want to make sure that your chart is well documented with all of your diagnoses to help support your ability to be successful working with insurance. Medicare also requires a period of conservative treatment, and that is usually 4 to 5 weeks of therapy, which can include all of these components, and using compression of one of these types listed here. And then other insurance, I should have probably said private insurance considerations, are going to be very similar to the Medicare considerations, and it's really going to vary. So Medicare is what Medicare is, but other insurance plans can have whatever they like. So we may have an insurance plan that only works with a particular durable medical equipment supplier, and in that case, the patient is going to only be able to obtain what is offered by that DME. So it's really important for us as patients and as providers to understand what an individual insurance policy does cover, the rules and regulations. We heard that earlier today, that it's extremely helpful to have and know your insurance policy to get the tools that you need to have your best quality of life. And therapists can assist patients in doing this. We can discuss these details with our patients. We can help them understand who their insurance company works with and to know what will be needed to support their request for a pump, and to practice self-care, because that's always going to need to be documented, that the patient is doing what they are capable of to help manage their condition. There's a recent change in Medicare guidelines, and this occurred in November of last year, so it's very recent. It is probably going to be beneficial overall to patients with these diagnoses because now, rather than having to go through a quote-unquote basic pump, which I will explain a little more in a moment, you can, with the signs and features such as sensitive areas, truncal swelling in the chest or the lower quadrant, you can go directly to the advanced pump, which is the E0652, and it certainly seems like that is less wasteful for the insurer and less potentially harmful to the patient to not have to use a pump that's inappropriate for them for a period of time before going to the correct one. So again, documentation is going to be so very important. And here it is just what the differences are. You can see that it's very little. It's just the E0651 does not necessarily have the ability to change the pressure in each chamber, and the E0652 does. And the E0651 also does not necessarily offer treatment to the body components of the quadrants being treated. So there's a couple of primary modes for treatment, and I think most of these E0652 have multiple modes in those devices, but the primary ones that tend to be used are the gradient or sequential type treatment, where the chamber that is the most distal fills first, with subsequent chambers filling following that at slightly lower amounts of pressure all the way up into the trunk, creating this push of fluid back where we want it to go, and then everything releases at once before repeating the pattern over a 30 to 60 minute period of time. We find that although there's no study that can show what is optimal for all patients, that those with a higher body mass or more fibrosis may like a higher amount of compression, and that this can help treat swelling trapped in deeper tissues as per this study. These patients may prefer this type of programming, and that can be very soothing, like a weighted blanket. But another primary mode of treatment is the peristaltic or wave-like treatment, and this may be more comfortable and better for patients who are leaner and who perhaps have less fibrosis, perhaps are more hypersensitive. And this technique starts in the same manner, where 1, 2, 3 chambers, and I'm generalizing here, but in general, a few chambers will fill, and then as the subsequent chamber fills, the first chamber empties, and so on all the way into the trunk before it repeats again, and that can be very soothing, and as can the other, depending on who we are and what we need. In Derkham's disease, I was not able to find a lot of information, so I'm very grateful to Dr. Herbst's paper from 2018, which recommends that these patients receive whole body treatment, so upper extremities and lower extremities with their body quadrants being treated. I personally would question whether we wanted to do all of that at one setting. I would probably do upper extremities at one time and lower at another, and that is for the patient and their physician to decide together. These patients are likely, from what I hear, to be very sensitive to the pressure, so that ability to have the E0652 and have that customizability so that we can determine every individual's tolerance for pressure is going to be very important. And typically, these patients may prefer that wave-like, soothing parasympathetic type of treatment for that diagnosis. So considerations for treatment, we've heard earlier today that with many situations we want to start low and slow with dosing. This is true with these devices as well. I usually trial a patient for about 15 minutes just to make sure they don't out and out dislike the experience. And then when they start having home treatments, I usually recommend starting at a lower amount of pressure for a shorter period of time and a single episode per day before increasing pressure, increasing time, and increasing frequency. Skin checks should always be performed before and after treatment because these appliances could potentially be irritating in some area. We certainly don't want to be creating secondary problems by using these devices to treat the problem we're trying to address. So that covering can be stockinette, which is often that base layer under the multi-layer compression bandages. It could be pajamas, something comfortable, but not your daytime medical compression garments, which are potential to rub and create problem areas themselves. However, an exception to that are these nighttime or lounging chip foam style garments that you see pictured, because they are not squeezing as hard and they can actually help create the negative pressure channels and help increase that efficacy of the device. And I had wanted to talk about the use pre and post surgeries. Bailey did such a great job of sharing this kind of information yesterday. I'm just going to say generally that I did speak with a few practices about their thoughts in the use of these devices. And of course, we want patients to be as decongested and in as low inflammatory state as possible before any kind of surgery, and these pumps can be helpful in achieving that. Afterwards, surgeons, I did not hear of anybody not recommending manual lymph drainage shortly after the surgery unless certain problems exist. However, the use of the IPC is, that I got a variety of answers to. Typically, I heard 3 weeks after surgery with incisions closed and not weeping. Now, I am not making any recommendations. I'm simply sharing information that was shared with me. There's not a lot of published information on this. There is a study about the use of the pump after lymphedema surgery from Campisi in 23, and there is not a whole lot. I couldn't find anything about Derkums, and I think it seems reasonable to extrapolate that with the same kinds of considerations and care, it could be useful for these patients to heal from surgeries as well. I want to just say that what I'm discussing is medical equipment. It is not over the counter. You need a prescription to have these devices provided by your insurance company, and to be even able to obtain them at all, a physician must prescribe them. The cosmetic versions, the things that you can buy online independently, do not have FDA approval for the treatment of lymphedema, and therefore we do not know if they are appropriate and helpful for our patients. So we really want to discourage those when the patient can obtain the E0652 to actually treat themselves appropriately. I've not seen, I have heard that there are cosmetic versions that have the truncal components, but I haven't seen those myself. So with lymphatic dysfunction, we want our patients to have the right providers. Obviously, we know the barriers to that, but as much as possible to find the right providers, work with knowledgeable healthcare individuals, especially with CLTs if possible. I am running out of time, so I'm simply going to say that there is some research to support this, and these devices are mentioned in the Lipedema standard of care as a helpful tool in the toolbox for these patients. And then with lymphedema, these devices are FDA approved for the treatment of lymphedema, so if we know that is present as well, we can consider that they are likely to be, pending the provider's approval, appropriate for those patients. And in conclusion, I want to say that these devices are constantly developing. These companies are really trying to make them easier to use, easier to travel with, more able to provide a variety of features and pressures, and that is going to improve the ease of use and the benefits to our patients. As providers, we should really know as much as we can about the features and the types of devices that are out there, and help our patients make determinations about which of these are going to help them across the continuum of care that they are likely to experience. And that is how we can support our patients. So here are my references. And here's my contact information. And I doubt I have any time left, but I'm eager to answer questions if I do. Thank you so much for your time this morning.